Hi, Andre here from the MSAG team. We're going to jump right into the video we made about how to break bad news to patients from our award-winning online interview course. Timestamps and link to the free course in the description below. Let's get started.
Breaking bad news is one of the most common types of roleplay scenarios in medical school interviews. It is commonly used by medical schools as it tests the ability of the candidate to remain calm under pressure. In addition, breaking bad news to patients, loved ones, or strangers requires practice, as it can be an uncomfortable environment to be in. However, as doctors, we are required to break bad news on a regular basis, and hence, this is a vital skill we must all pick up. In this video, we will teach you a common framework which can be used when breaking bad news. We will then show you a live example of how this framework can be successfully applied to gain maximum marks in this MMI station. The roleplay scenarios you're faced with may be non-clinical. For example, you could be asked to tell a friend that you're unable to attend their birthday party. They may also be based on clinical scenarios, such as telling a patient that they have cancer. Remember to demonstrate empathy and active listening skills throughout the scenario. Let us imagine you were given a scenario where you had to tell a patient that they had a terminal diagnosis of cancer. What are the important elements not to miss in this roleplay? Bale and Buckman came up with a useful mnemonic to deliver bad news to patients in a medical setting. The mnemonic we recommend that you use is called SPIKES. The S stands for setting the scene for the discussion. Usually in an MMI, the setting is already adequate for the discussion. But remember, if you are having a sensitive discussion and the scenario puts you in a public area, it may be appropriate to ask the role player if they are happy for the discussion to take place in the current environment they are in. You must always introduce yourself, explain your position or role to the patient, and confirm the patient's identity. For example, you could say, "Hello, my name is David and I'm a junior doctor. Am I talking to Jane?" We also recommend that you ask the patient or actor if they have any relatives or loved ones with them who may want to participate in the discussion if this is appropriate. The P stands for perception. This is the process of clarifying that you are on the same page as the actor if this is relevant for the scenario. Ask them questions such as, "What is your understanding of why we are meeting today?" This is important to ensure you minimize any shock the actor may experience from the news. The I stands for invitation. At this point, you should explain to the actor that you have some bad news to tell them and ask them permission to proceed. This gives the actor a warning that there is some difficult news and allows them time to prepare themselves. For example, you could say, "I'm afraid I have some bad news." And after a pause, you could then say, "Is this an appropriate time to discuss something with you?" The K stands for knowledge. This is where you must explain to the actor exactly what has happened. This should be done in a sensitive and careful manner. Avoid the use of jargon and simplify your explanations to allow the actor to process the information being delivered. The E stands for emotion. Having delivered the bad news, listen to the actor's concerns. Do not be afraid of short periods of silence. It is important to let the actor process the information you have delivered. Candidates often feel the need to continue speaking after delivering bad news to try and regain control of the situation. Instead, we recommend that you allow the actor to vent his or her emotions and ask them open questions about their feelings. Often they can be forthcoming, but sometimes you may need to ask open questions such as, "What are your thoughts?" to address their emotional needs. It is important to display empathy and show active listening skills. We recommend that you apologize, if appropriate, even if the situation isn't directly your fault. Finally, the S stands for summary. Reiterate briefly the information you've given and, if appropriate, suggest a plan for the future. This may also involve discussing some solutions to make the actor feel better in the moment, or solving a problem. For example, you could say, "I'm sorry that this news has made you feel upset. Is there anything I can do to help?" Finally, we recommend that you ask the actor if they have any further questions or concerns, and then thank them for their time in order to conclude the station. The SPIKES framework can be adapted to any breaking bad news scenario. Let us now look at an example of SPIKES being put into practice. As you listen to the roleplay, we recommend that you make notes on how the SPIKES framework is being implemented. Mr. Parker is an Olympic high jumper. He fractured his ankle during training and it will take at least 8 months to heal. He has been training hard for the Commonwealth Games, which are 3 months away. You are his doctor and you must break the bad news of his ankle to him and explain that he will be unable to perform in the upcoming tournament.
Hello, I'm
Hi
Dr.
there.
Reed. Are you Mr.
Hi.
Parker?
Yes, that's right. Hi, nice to meet you.
Okay, well, nice to see you today. Do you know why you're here?
Yeah, I think just coming here for some results.
Yes,
my
it's,
scans.
it's to review your test results,
Yes.
basically. Have you got anybody that you'd like to have sitting in with you?
No, it's just me today. Yeah,
Okay.
yeah.
Well, I'm going to talk to you about your ankle injury that you had.
Yeah.
And unfortunately, it's quite a significant injury.
Oh,
Do you mind
really?
if I talk it through in a bit of detail now?
Yeah, I suppose you better do so. Yeah.
What do you think might have happened to your ankle?
Well, I've been training really hard, as you know, for the Commonwealth Games, and I sustained this injury with my ankle. It still hurts a little bit, but I thought I was over the most of it.
Well, looking at the scans
Yeah.
and looking at the history and the kind of the nature of the injury, it looks as though you had quite a significant injury. Unfortunately, the bone is broken in such a way that it's quite a bad fracture. It's actually going to take quite a long time to heal.
Really? How long were we thinking?
Well, I think given the nature and the degree of the injury,
Yeah.
we're talking quite a long period of time. We're talking at least 8 months or so
8 months?
for this to get
Oh my
fully
God.
better.
Doc, I mean, I've been training so hard for these games. You know, I've been working so many times with the physiotherapist. Is there nothing that we can do in the next 3 months to get me to those Commonwealth Games?
Well, unfortunately, and this is quite difficult news to convey, given the nature of the injury itself,
Yeah.
and the degree of the break, it's going to take a long time to heal up. So there are other things that we have considered, such as surgical intervention or physiotherapy or
Yeah,
using
I'll
various
do them
medication.
all. I'll do them
But,
all, Doc. Please, there must be something.
Unfortunately, I don't think with this kind of injury they would be adequate. I don't think they would do enough, and that's a really hard thing to have to tell you, because I know that you've got the Commonwealth Games coming up in a short space of time.
It just can't be this. It's just such a nightmare. Nothing else we can do then.
Well, we kind of racked our brains and thought about all the standard things that we would do in this
Yeah.
kind of scenario, and it's really difficult to heal this kind of fracture. And I'm really sorry to have to convey this news to
Yeah.
you, because it's not going to be healed up within such a short pace of time.
Okay. Right. Well, thank you for being honest with me.
Well, I think that's the main thing, is to kind of be upfront and let
Yeah.
you know, because I wouldn't want you being unrealistic in terms of how this might heal.
Yeah, of course. Okay. Right. Well, thank you very much for the information.
That's right. Is there anything I can do at the moment?
No, I guess I'll just go home and tell the team and my wife, and I don't really have any questions at this point in time.
Well, if you do later on, or
Yeah.
if your family or your team want to discuss it in more detail, then I'd be very happy to. You always get in contact and we can talk about it again in more detail.
Okay, all right. Well, thank you, Doctor. Thank you for being honest with me.
Okay.
We hope you were able to successfully pick up on the spikes framework through watching this roleplay. That's everything we want to cover in this video. We have discussed a common framework which can be used to approach Breaking Bad News roleplay stations. We have shown you a live example of how this framework can be successfully applied to gain maximum marks in this type of station. Hopefully you can now begin to use spikes yourself when practicing roleplays.
Thanks for watching. Is there a specific Breaking Bad News scenario you're preparing for? Do you have any questions about how to use spikes for medical or dentistry interviews? Let us know in the comments below. If you find this video helpful, please leave a like, and if you want to see more interview or exam prep, then subscribe to our channel for new content every week. Take care and best of luck with your admissions.